Welcome to TAF UPSC channel. It's really happy to see you all here. For UPSC, to get more informative videos, you can follow TAF UPSC YouTube channel. And for further getting informative updates, you can follow TAF IAS Academy UPSC Telegram channel. And today, it's a global story, shines a light on a silent struggle that affects the millions worldwide. So the World Health Organization has released its first ever global guidelines on infertility, a condition 1 in 6 adults that has their lifestyle. So what is this new in this guideline? So let's find out what are the various important things that has mentioned in the guideline. Actually, the guideline has fragmented into different segments. So the first, it talks about the global struggle hidden on silence. So World Health Organization, it talks about infertility. Infertility in the sense, years on, the couples getting struggles to get conceived have done so in struggle, silence, shameful and confusion. But the World Health Organization says that it's time to talk openly. For staggering, every 1 in 6 adults experience infertility. So did you know infertility is this common? Why do you think people rarely talk about this? And the second segment, it talks about the guidelines, that the first ever guidelines released by the World Health Organization on infertility. The guidelines is very clear in their aims. It advocated the evidence-based treatment, stigma-free support and equitable health care for both men and women. Yes, infertility is not just a women's issue. It affects the men just as much. But why do you think society still blames the woman more regarding for infertility? And the third thing, the guidelines, it talks about prevention, the first line of defense. So the World Health Organization, WHO, says that prevention, it begins through awareness on various key points of lifestyle factors like smoking, alcohol, awareness on age-related fertility decline, overweight, stress and unprotected sex leads to sexually transmitted infections. These are the various lifestyle factors that is mentioned in the WHO guideline. As well as the guideline also even recommend consultation, to provide the consultation on smoking for just 30 seconds to 3 minutes for the people those who are visiting the healthcare facility. So does fertility education should be taught in schools? Do you believe that sexually transmitted infections or smoking seriously affects the infertility? Then the next segment, it talks about diagnosis. So WHO guideline makes the diagnosis more simpler and easier, because WHO wants to avoid unnecessary and expensive medical checkup. For women, it supports the luteal progesterone test for checking for ovulation, and for uterine infection, it would be identified through saline infusion sonography. And for men, seminal test. So if the result is normal, means there is no need more for further any more tests. But if the seminal test, the results are abnormal, means the test should be repeated after 11 weeks. So these are the various diagnostic method that was mentioned in the WHO guideline. Do you think that unnecessary medical checkup should be avoided to reduce the stress and cost? Then the WHO guideline, the next segment, it talks about treatment. So WHO guideline breaks the treatment into a more simpler manner. For women affects with PCOS test, means PCOS disease, means it that guidelines provides priority test like letrozole, gonadotropins. If the earlier test was unsuccessful, means they can recommend the IVF, in vitro fertilization. And the WHO guideline recommend the IVF for the women, those who are above 35 years age, recommendation. And for men, if they affects the varicose means the guideline recommend the surgery. So these are the various treatment pattern. The treatment should be in a rational manner that was advocated or advised by the WHO guideline, that is a guideline on infertility. And further, the next segment, it talks about, it says that if everything looks normal, but still there is an anonymous, unexplained infertility, it is one of the most stressful situation for the couples. But WHO recommends a calm and step-by-step approach. It recommends expectant management for 3 to 6 months. If it was unsuccessful, means they can recommend the IVF, in vitro fertilization. But the ICSI, the treatment of ICSI, that is intracytoplasmic sperm injection, not to be used until it is recommended. So these are the way, but still, how do you feel that test results were normal, but still pregnancy doesn't happen? It's a kind of a hypothetical situation happen in nowadays some kind of people. And finally, the WHO guidelines recommends more compassionate, hopeful and renewed hope with WHO guideline on the infertility. Because the WHO guideline document, it's not just a medical document, it's a message for the millions. It says that you're not alone. Infertility is just a medical condition, not a personal failure. So in the world where the infertility is just hidden behind the closed door, the World Health Organization opened the door for a honest conversation, scientific clarity, rational based treatment, and the treatment should be affordable, rational based manner, and it should be equitable healthcare to both men and women. And finally, WHO guideline, the first ever guidelines on infertility. It's not just a document, it's a promise for the millions, those who are trying to build the families. Thank you very much.